Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted physician.
Hi, I'm Dr. Alison Kole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did. Hello, and welcome to the Sleep is My Waking Passion podcast. I am your host. You know who I am. I wanted to introduce a very special guest today. This is Dr. Surkin. He is sort of a unicorn in our field. He is both a cardiologist as well as a sleep specialist. It's just wonderful, Lee, to have you. You basically founded the American Academy of Cardiovascular and Sleep Medicine. And so it literally started as an organization. He has been, a pioneer in this field for many, many years. And without further ado, Lee, do you want to say any other words to our audience?
Well, first of all, Alison, thank you so much for having me. It's an honor and a privilege to be here with you, and looking forward to sharing lots of information for your podcast viewers.
Awesome. So what we're really hoping to do on this episode is really kind of bridge the connection between the importance of sleep, specifically good sleep, which we will talk about what that means, and how poor sleep actually negatively impacts the heart. So, when I think of it, and please, I want your input and your feelings on the matter as well. When I think about sleep and heart health, I look to, poor sleep that I generally will describe as being either, an issue with the quality of sleep or an issue with the amount of sleep that you get. So in general, that's the kind of broad overview definition. Anything you want to add to that?
You're exactly right, Alison. It's quality and quantity when it comes to sleep and the heart and sleep and really any other of the associated disorders. But specifically regarding the heart, it's critically important that, first of all, people get enough sleep. And there have been, I'm not going to go into the scientific trials, but other than to say that you can sleep too much, you can sleep too little. Studies have repeatedly shown that if you sleep longer than 9 hours or less than 6 hours consistently, then it will start affecting your heart and actually lead to bad cardiac outcomes like the development of cardiovascular disorders. So getting enough sleep in the right amount, and we usually quote 7 to 8 hours or 7.5 hours of sleep seems to be the sweet spot for that. Quality of sleep is critically important as well, because anything that is going to disrupt your sleep, from having a cough or having a cold or having a sleep disorder or anything that you might take before sleep that could disrupt your sleep, like alcohol, things like that can reduce the quality of your sleep, can also increase the long-term risk of heart problems.
So really what we're going to focus our discussion on is prevention, but I am going to hint at, potentially if we have enough time, the fact that unfortunately, once you start to develop heart problems, one of the issues is that once you've gone beyond the prevent the heart problem stage and now you're into the actual disease stage, there is a bidirectional relationship, meaning now your heart not functioning properly actually can negatively impact your sleep. So it's like this swirl that you get into. So one of the things I did was I listened to a really cool video as I was prepping for this. And it was a video looking at, it was kind of geared toward women's cardiovascular health, but it was quite general. And Michael Grandner, I know, has done a lot of research over the years with some of the relationships with sleep, and actual various health outcomes, including cardiovascular health. So I'm just going to give you some things that I learned from this video that he was on. Totally available to the public. I think I Googled something about it and found it. But if you are sleeping less than 6 hours, just to give you an idea of the sense of duration of sleep, what he was talking about was that you're literally like 55% more likely to be obese, which we know is not good for your heart. 21% more likely to develop high blood pressure, hypertension, and 33% more likely to develop diabetes. This was like, it kind of blew my mind because when we talk about all of those things, those are all sort of things that we see associated with issues related to your heart. And we talk about sleep apnea and how it could potentially increase systemic inflammation, and that systemic inflammation may also be related to the heart. So I'm going to sort of, we've kind of beat the insufficient sleep or lack of sleep thing a bit. So I'm going to kind of turn it over to you and talk a little bit more of that sleep disruption quality, the poor quality of sleep. And, one of the things we know, because it's so common, is that there are many sleep disorders that may disrupt your sleep. Obstructive sleep apnea and the heart have been studied a lot. So, can you share with folks kind of why it is that disrupted sleep can be bad and potentially how obstructive sleep apnea fits into that paradigm of contributing to heart disease?
Yeah, so obstructive sleep apnea is the poster child in this whole discussion about sleep in the heart. However, we must not lose sight of the contribution, the negative contribution that things like insomnia has, restless leg syndrome, other less common sleep disorders like narcolepsy have implications affecting the heart. You mentioned Dr. Grandner. Mike Grandner is an expert in behavioral sleep medicine. And in fact, he gave a riveting webinar on my academy about insomnia and the heart not too long ago, just a few months ago, on the American Academy of Cardiovascular Sleep Medicine. So what we know is, as I said before, that anything that disrupts the quality of sleep on a consistent basis can affect the heart, and there is an inflammatory process that occurs. Inflammation is associated with obstructive sleep apnea and other sleep disorders. Inflammation is bad for the heart. It leads to the development of heart disease, and it can increase the likelihood of arrhythmias and eventually even potentially the development of heart failure. So obstructive sleep apnea, as the poster child, has lots of bad stuff that happens. Your airway obstructs, the oxygen level starts to drop, the brain senses it, creates a surge of adrenaline, which is that fight or flight hormone, like you're about to be mugged. Your heart rate will go up, your blood pressure go up, you're ready to fight or run. So if you're about to be mugged, that's obviously a protective thing. But gosh, if it happens as a result of an airway obstruction repeatedly, now you've got all of this circulating adrenaline in your body, that's affecting your heart. Combine that with drops in oxygen level, and your heart is really stressed out during obstructive sleep apnea. Insomnia, the disruption in sleep, the difficulty falling asleep, difficulty staying asleep, has similar negative effects to the heart, but not quite as robust as obstructive sleep apnea.
Question for you,
Yeah.
because I've gotten this question a lot too in my office practice. What are your feelings about mild versus moderate versus severe sleep apnea and the potential negative impacts on the heart?
Yeah, so studies that date back a long time ago sought to answer this question. First of all, how does sleep apnea affect the heart, and what is the impact of severity? So we have this guideline, if you will, to determine severity based on the number of airway closures per hour of sleep that will help determine mild, moderate, severe. And studies have shown that that if you have, let's say, high blood pressure, diabetes, other medical problems, any severity of untreated sleep apnea, can lead to an increased long-term risk of cardiovascular problems. If an individual is otherwise completely healthy, no high blood pressure, no diabetes, no, lung problems, whatever, if they have moderate or severe sleep apnea left untreated long enough, there's a significant increased risk of developing cardiovascular problems. So there's a very clear association that in some cases depend on the presence of other conditions, but in some cases doesn't really matter. If the sleep apnea is bad enough and left untreated, you're at significantly increased long-term risk.
That is a great point. Out of curiosity, I was just wondering what your experience has been. I have had some folks where you almost feel a little crazy for putting them on a machine. Like they're so mild. You're like, really? You want to go on a machine? I don't know if I would want to go on a machine with such mild sleep apnea. My opinion is that when people are sufficiently symptomatic, maybe they're really perceiving that the quality of their sleep is bad. Maybe they're waking up a lot. Maybe even though they have relatively mild sleep apnea, and again, one could get into the weeds with whether or not they have a comorbid other sleep disorder, but if they're feeling like they're really unrefreshed or super tired during the day, even if it's quote mild or not that many events, I've had instances where I've actually put people on therapy and I'm almost blown away with how well they're doing. Like they literally are like, "Oh my god, this is so life-changing for me." So, I would dare make the argument that even if they are otherwise quote unquote healthy, if they're having symptoms and their sleep quality is poor and they're really not doing well from that perspective, treatment even in the mild case, I don't know if there's any data to this, but I would imagine it might have potential cardiovascular benefits simply because looking at the insomnia data and sort of extrapolating, like you're still sleeping like crap. So if we can improve that, maybe we're doing a good thing.
Yeah, and I agree. So symptoms are obviously critically important when we're taking care of our patients. We want to help them feel better. We want to improve their quality of life, and we want to help them live longer to the best way that we can. So yes, symptoms are very, very important, a very important indicator of treatment, potential treatment benefit. As you know, Allison, there's more treatments other than the machine, the CPAP machine, which is a very elegant treatment. But if I may take some liberty here, I've been a proponent of a multifaceted approach to individualizing a patient's treatment. So we know that CPAP works extremely well for any severity of sleep apnea, but we also know that it's really tough to get used to. It's tough to have a mask on your face. It's tough to adjust your breathing to air pressure coming into your airway. A lot of people take to it like a fish takes to water, but an awful lot of people struggle with it. And that's where, as sleep medicine physicians, I'm very excited at the path that we're taking towards a more individualized approach to treatment. CPAP is great, but the dental appliance, which is, as you know, a retainer device that you place in your mouth, provided to the individual by a well-trained dentist in sleep medicine, can make all the difference in the world and has been shown to be much more widely accepted from a compliance standpoint than CPAP, and approved as a first-line treatment for mild or moderate sleep apnea. And for those people who just can't tolerate CPAP for severe or just don't want to deal with it at all, it's also a very viable option. So I've been on my bully pulpit for years and years with regards to individualizing treatment
Show and tell time.
and getting
Chomp
people
chomp.
on. Yeah, there you go. Boom. Got it right here. So we are kindred spirits. Sleep physicians owe it to their patients to be open-minded. The overwhelming majority of us are. And the challenge with regards to the dental option is finding that dentist who is well-trained and has put in the time and effort from an education and experience standpoint to be a very valued colleague to the sleep physician.
That is such a
And that's
great
something I'm
point.
working on as well. by the way. I mean, I'm working on that on a national level with a company called Nexus Dental Systems. I don't want to belabor this talk, but it's going to revolutionize dental sleep medicine. So there, I said
All
it.
right. Well, I'm going to be excited to see what you come up with because you have already done some really, really amazing things. And it's funny that you're bringing up CPAP alternative like an oral appliance therapy because I literally had the opportunity to speak with a sleep dentist, Stacy Ochoa, out from Missouri yesterday, and we were kind of getting a little into the weeds. We focused that conversation on pediatrics, actually, and pediatric sleep apnea and what you can do from the dental perspective for the developing jaw, which I look at as also being a way to sort of prevent long-term issues that from the adult perspective. And we're going to meet again to kind of talk a lot more about oral appliance therapy. She is a diplomat of the American Dental Sleep Medicine, American Academy of Dental Sleep Medicine. There's so many acronyms. I got to like think about it for a second. But she is somebody in translation who has really gone above and beyond to get that education. And I agree with you. If anybody's going to entertain getting treated for obstructive sleep apnea and wants to look at oral appliance therapy, again, as Dr. Surkin mentioned, it actually is a really viable option that works really well. And there's some data probably that's going to come out that it may even be better than nothing, if you will, for more severe cases, depending on what the issues are. You might get a better bang for your buck than between one person versus another. I think that's an active area of study, is just trying to figure out what's the right therapy, as you mentioned, individualized approach. What's the right therapy for the right patient, right? Um, and and the reason that, Lee, if I may say so, that you emphasize the importance of a dentist who has a lot of experience and passion for this is that just like CPAP, right? People, if you're on a machine for your breathing and it's pushing air into your lungs, it's not uncommon for people to say, "Oh, my mouth feels dry," or "that pressure feels a bit much." And one of the biggest complaints I get, especially with the ladies, is, "Hey, listen, it's kind of squishing my cheeks and I'm getting some wrinkles. I don't really appreciate that. And so those are quote unquote side effects, right? Those are some potential downsides of using a machine for sleep. The oral appliance also may potentially have that. You're kind of pulling on the bottom jaw to give yourself an underbite. And for some people, that may leave them needing to put in an appliance during the day for a brief amount of time just to kind of reset where the jaw position goes. So, you want someone who understands what the good is and what the potential side effects are so that you could properly navigate to make sure that that's the case. Um, I wanted to get speaking of CPAP alternatives, why not talk about Inspire therapy? I figured I'd throw that there. That's really indicated for people with more moderate to severe disease. Um, I've had some the data is pretty robust that it can be effective. The goal here is not perfection so much. You got to understand that when we're looking at the data, that's what we're seeing. Um, but I think it is a viable option, again, for the right patient. I was just curious what your thoughts were.
Yeah, so along that same mindset, we had an expert ear, nose, and throat physician from Minnesota give a webinar on at my academy earlier this year on the benefits of what's called upper airway stimulation therapy for the treatment of sleep apnea and the benefits that it may have for the heart. There you go, bam. So it's exciting. They've come a long way with their technique and their software. In the early days, so what the device does is every time you take a breath in, it will stimulate the nerve to the tongue to move the tongue forward. So what's happening with sleep apnea is as you enter deeper stages of sleep and the muscles of our body relax progressively, it allows the jaw to relax. The jaw moves backwards, brings the tongue with it, and the tongue will eventually close off the airway. So what CPAP does is it uses air pressure to keep the tongue forward. What a dental appliance does is it basically provides stability for the jaw to keep the jaw forward so it can't move backwards. And what the upper airway stimulation therapy does is it will stimulate the tongue to move forward when it wants to move backwards related to sleep apnea.
This is an implantable
So,
device, guys, and this is just a sort of
yeah.
prototype of what they look like currently.
Yeah, so think of it. Listen, as a cardiologist, things sort of boil down to cardiac for me always. So it's kind of like a pacemaker for your tongue. It is implanted, absolutely, Allison. It's a second line treatment for obstructive sleep apnea. And for those folks who can't tolerate CPAP, maybe are not candidates for a dental appliance, then the upper airway stimulation device is a definitely viable treatment option.
Can you talk to the positive effects of actually treating sleep apnea? So it's like fine to say, okay, well, we know you do better if you treat it. Okay. Well, are there, what's the data behind like actually getting to the core of it, improving sleep? I did stumble upon this was a really tiny study, so I'll just mention it and then turn it off over to you. They looked at it was a study done in New Zealand that was published in 2021, and it only had like 121 patients. So it was not like this giant study. But what I found very interesting about it was that if you had 3 or more cardiometabolic risk factors, so a lot of the things that we're talking about, so if you had issues related that might potentially put you at risk for cardiovascular disease, like the obesity, hypertension, diabetes, etc. If they were able to improve the length of your sleep efficiency, meaning how much time you're spending in bed that you're actually sleeping. That's what we're referring to. Then they actually noted that, your systolic blood pressure, that top number of your blood pressure seemed to improve. And then I was also fascinated by the fact that it seemed they also were able to demonstrate, again, smaller patient population, but that that bad cholesterol, that LDL that we talk about was lower, and the HDL, the quote unquote good cholesterol, was a bit higher. So small, but I think kind of profound little study that they did. And that's just by improving kind of the quality of your sleep and potentially the duration, as we mentioned. So just those parameters without necessarily having a quote unquote comorbidity. Can you talk about, treatments and how they may potentially affect the heart in a positive way?
Yeah, so there are clear studies that show benefit in sort of stabilizing the heart's electrical system. There are studies that show improvement in quality of life, improvement in the ability to manage heart failure. There are studies that show that we can lower the inflammatory markers when treating obstructive sleep apnea. And really so much of disease is related to inflammation that it's critical. In fact, I just read an article earlier today looking at 2 different cholesterol lowering medications. I'm digressing just a tidge, that showed that that they work similarly well, but one of them lowers the bad cholesterol more so than the other, and yet they had similar outcomes. And they determined that the stronger predictor was the impact on lowering inflammation
Wow.
that these
Wow.
medications do. So that was an eyebrow raiser for me. Interesting study. So back to the sleep aspect, what has been controversial and is still yet unclear in the literature is can we tell our patients with heart disease and obstructive sleep apnea that putting them on the machine on CPAP will reduce their risk of a heart attack, will lengthen their lives with heart disease. And there's been some controversy there because there have been studies that have come out, and some larger studies where they studied several thousand patients on CPAP with obstructive sleep apnea, obviously, and heart disease, and they basically didn't show any significant improvement in long-term cardiac outcomes. But when you dig deeper into the studies, you find that the average amount of time that the subjects used CPAP was actually like 3.5 hours, 3 to 3.5 hours. So when you look at what happens with obstructive sleep apnea over the duration of the night when you're asleep, more of the events tend to occur in the second half of your night than in the first half of your night. Why? Because you get deeper sleep. You get more what we call REM sleep, or rapid eye movement sleep, which is where the body is at its greatest degree of relaxation, which increases the likelihood of more frequent airway obstructions. So now think about it. Take a step back. If an individual is using CPAP for 3.5 hours per night, they're going to put it on at bedtime, right? And take it off 3.5 hours later. Well, that's only maybe the first half of the night. And you're missing the majority of events that happen in the second half of the night. So, granted, the studies have not shown beneficial outcome data in treating heart disease with CPAP. However, when researchers looked at the subjects that actually used CPAP longer than 4 hours per night, they started to show benefit, with particularly more so stroke than heart attack, but some beneficial effects with overall cardiovascular disease and outcomes. So therein lies the challenges that we sleep physicians face, and that is compliance or adherence with CPAP. So for our patients who can use it all night long, there looks like there's probably long-term significant benefit in reducing cardiac events, but we can't be definitive about that at this point. The data is suggestive but not conclusive. There's studies that are going on that look at data from multiple different studies that do show beneficial effects when CPAP is used more than 4 hours per night, but those are not quite the scientific, what we call randomized controlled trials, where they're just much more rigorous from a scientific standpoint.
I really liked this study that I came across, and it was sort of presented at the European Respiratory Society meeting in Milan this year. And it was Dr. Jordi de Botley. I'm probably butchering their name, but they're from Spain. And so they were looking at folks. And what I liked about it was they were kind of following these folks over time and looking at what happened in terms of people that were, what I liked about it was there were people that naturally aren't going to be adherent to CPAP. So they just knew that these, like, it's not that they're randomizing, like, we think this, we just want to randomize you to like no treatment and see what happens. They really kind of left that part out because that's one of the tricks. That's what makes it more challenging to do some of these studies, is that like sometimes you're kind of like, is it ethical to randomize somebody to no treatment? But they were able to follow people who didn't use it versus people that did. And there they, they were actually able to demonstrate, again, it was fairly significant study, over 3,500 patients. Again, not randomized per what you're describing, but it lends itself to some newer data with a different approach, looking at things a little differently, perhaps better, to your point, because of duration and of usage and everything, in terms of hours of usage per night, and being able to demonstrate that it probably is making a positive impact on cardiovascular disease. Again, nothing definitive, but it has been one of those things where I feel like sometimes, as someone who tries to nerd out on this topic, I feel like one month I read, oh yay, hooray, it seems to be good. And then I read something else and it's like, oh, not so good. So you're left kind of scratching your head. So in full transparency, we're all doing the best we can. We suspect there's probably a benefit, but part of it's we're only as good at figuring stuff out as our tools are. And sometimes we got to question, how was that study designed and how exactly did we get that level of data? So I really appreciate your insights on that.
So let me give you two additional points that you mentioned earlier. There's pretty reproducible, clear evidence that high blood pressure is improved by treating obstructive sleep apnea, and that goes for CPAP. And there's some data looking at the oral appliance as well being beneficial. The other aspect is still not entirely clear, as based on what you just said. There's data showing that, for example, patients with atrial fibrillation, which is an irregular heart rhythm, if they have sleep apnea that's untreated and they go to their cardiologist to try to convert their rhythm to normal, there's a much greater likelihood of recurrence of atrial fibrillation if their obstructive sleep apnea is untreated. If it's treated, then patients do just as well as what we call control patients, patients who don't have sleep apnea. So there's lots of benefits in treating obstructive sleep apnea for the heart. There's data that's ongoing, that there's data that we need to be done to help us refine our practice guidelines so that we can give you, our patients, clear guidance on what to do.
And I'm going to be curious as well because there's been, for example, I was chatting with Jeff Dermer, and in full disclosure, he works with Sleep Image. And one of their main focuses is on sort of the autonomic nervous system, meaning that fight or flight. How does your heart rate and blood pressure and sort of that surge in adrenaline, if we can capture that, kind of basing it on the number of arousals, I almost wonder if our paradigm might shift a scotch from strictly, okay, this is, there's no doubt in my mind that yes, low oxygen levels are not good for your blood vessels. That's makes a lot of logical sense on multiple levels. But I do find it fascinating where the frequency of arousals outside of having like an airway obstruction, kind of getting a bit into what happens with insomnia, where you're having a lot of arousals from sleep potentially, how that's going to figure into cardiovascular health and potentially shape the way we sort of view some of the outcomes and how we interpret some of the data in the future.
Yeah, I met with Dr. Dermer a month ago with a meeting that I had uh, with another company that I work with, which is Virtuox, as chief medical officer. And we use that device on many of the patients for testing, determining if they have obstructive sleep apnea. And it's a neat device, a ring device that's been approved to diagnose obstructive sleep apnea using a different technology, as you said, looking at this interconnection between the heart and the lungs and signals that come from the heart and the lungs in response to airway obstruction and drops in oxygen and arousals from sleep. And what's also very interesting, Allison, is in addition to insomnia, this rare disorder called narcolepsy, which is a result of a reduction of a substance made by the brain that's responsible for keeping us feeling awake all day, called orexin or hypocretin. The brain just doesn't make enough, so these individuals are plagued by sleepiness all the time. And it's, if you don't think about it, as you know, Allison, that the individual will have a significant delay in being diagnosed. So what's interesting about narcolepsy is that their sleep is typically very disrupted, and it's felt to potentially be contributed to by this insufficient amount of orexin. And these individuals have a significantly increased risk of cardiovascular problems, heart attack, stroke, heart rhythm problems, passing away, from cardiovascular issues. It's a fascinating disorder, and I think it's not quite as rare as we think. I think it's more underdiagnosed, but still rare, and is sort of a poster child, if you will, for individuals who have disrupted sleep and go on to develop cardiometabolic problems and develop obesity and diabetes and heart problems over the duration of their lives with this disorder.
Lee, this has been so much fun. Thank you so much. And I hope you guys take away with you just how significant, and maybe some of your answer questions have been answered too, just based on what Lee and I have experienced in our practices in terms of what that relationship with is really hard to describe in, however long a regular consultation is, just the depth of the relationship and the intricacies of how the heart and sleep are so sort of married, if you will. So, Lee, this has been so much fun. I truly appreciate your time. I am signing up to be a member of your society because it's super cool what you were doing. And honestly, the lectures the ones that I met Lee sort of after some of the lectures that he described had occurred. And I can tell you, um, they're eye opening and really well done. So kudos to you. Really.
Thank, thank you.
I mean, getting
Thank
at
you.
really cool stuff like COMISA, for example. So Alex was a guest here, and I literally found out about him because of you, because of your organization. So very much appreciated. Thank you.
Alison, thank you so much for the invitation. It's been a pleasure. And, anything I can do to help the general public learn more about sleep in general, sleep in the heart, I'm always more than happy to do.
Awesome. Thank you. Hello to all my fellow sleep biohackers out there. I have a call to action for you. If you are enjoying this podcast, if you feel that you are growing, you're more knowledgeable, you're feeling empowered about your sleep, that is the purpose. So please, please take the time to like and review the podcast, share it amongst your friends and family. Please follow me. If you'd like to follow me on Instagram or Facebook, I am there as well. My handle on Instagram and TikTok is AskTheSleepMD. And you can also go to my website, AskTheSleepMD.com, for more information about each of these episodes. We will be sharing with you cited articles that you can actually refer to and read yourself if you like, and lots of juicy tidbits about how to sleep better. Thank you. This podcast is made possible with the exquisite talents of Mr. Joey Salvia, my producer, Mr. Adrian Pederath, my creative director, and music by Lori Kunzel of kunzelmusic.com. Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.